back, as promised, a conversation of COVID-19 in our slums. Joining us by way of Skype is Dr. Gabriel Njue. Dr. Njue is the head of clinical services. Dr. thank you so much for your time this morning. Unfortunately, our slums here in the capital city have become quite a matter of concern when it comes to fighting COVID-19. What have you been able to see, apart from just the rising numbers? What challenges have you been able to see on the ground when it comes to containing COVID-19 in our slum areas?
Thank you so much for having me this morning. And yes, the COVID epidemic is a challenge not only to the high density populated areas, but generally globally. But where there is a density of human beings, high density of human beings, what we are seeing is a few challenges which may not be in other areas. One of them being the ability to social distance. And number two is also having human behavior, which is not quite well in keeping with the guidelines that are being issued by the Ministry of Health and the Public Health Sanitation Guidelines.
Right. And Dr. Njue, how does Corona affect our Nairobi slum residents?
Well, not only the slum residents, we also, especially the densely populated areas, is that one, there is the social impact, there is the economic impact, and then the impact in the health field. The social impact is where now we have had people to get accustomed to using of the masks. And then also being indoors, which they are not accustomed to. And then being the indoors, there is also the loss of the income. Then you also have tended to have frictions within the families, leading to a little bit of gender-based violence. Now, on the economic side, is that where we have loss of jobs, and we have closure of businesses, and people are a little bit idle in the houses. While on the side of the healthcare system, what we are seeing is many effects. There is increase in healthcare messaging, which is very good. The government has done very well. And even the private players like Penda, we have been explaining and teaching to our clients. But there is also the negative side. And there is also the negative side where then the population has abstained from coming to hospitals even when they are.
One concern that CS Mutahi Kagwe has had for the longest time right now is perhaps the attitude of Kenyans towards COVID-19. How has the attitude or people's attitude contributed to the increased number of COVID-19 cases in our slums?
It has contributed because the human attitude, the virus does not move. It is the human beings who move. And they are the ones to move with this virus. So when the containment measures are being issued by the government, and then in the densely populated or anywhere else, then people do not adhere to this because of very many factors. One, people refusing by themselves, or because of circumstances. People will not go hungry and they are in the houses. But the greatest factor is actually just the human behavior, especially where there is deliberate refusal to adhere to the guidelines. Then you find during the day, maybe they have mask. When evening comes, they remove the mask. They attend to their small parties and drinking areas. And, these violations have really contributed to the movement and the spread of the virus.
I hear you, Dr. And perhaps how can locals take things now into their own hands? How can residents, Kenyans who are living, even though it's not just even in our slums, just populous areas in general, what can they do to take matters into their own hands?
Number one is that every other citizen has to take responsibility of their hygiene as number one. And number two, you need to adhere to the public health messages which are being preached and taught in every other health facility and being spearheaded by the public health. Ministry of Health. And number three is that people should not now abstain from the health facilities when they are sick. I would like to tell the population that health facilities are safe. Like in Penda, we have implemented where we screen even our own providers, the healthcare people. So people should not avoid coming to hospital. We have also gone ahead as PENDA and many other health institutions to ensure that we are having a call center whereby you can call, because we don't want our chronically ill patients of diabetes, hypertension, the children who require to be immunized, the pregnant mothers to abstain from coming to hospital, because what we are going then to see is an epidemic on top of another epidemic.
Right.
Think, for example, of children under 5 years who are not brought to immunizations, or mothers who have not, expectant mothers who are not coming for antenatal follow-up. What you are going to see is a surge of measles in these children, and then also maternal complications during delivery.
I hear you. And Dr. Gabriel, allow me to even shift the topic a little bit and talk about the lack of our urban development. And this is such a question that is coming at an irony time when we're reading our budget tomorrow. But Dr. just talk to me about how lack of proper urban development is sort of affecting or impacting our battle of winning COVID-19. Whether it is water sanitation, whether it is water within our slum areas, whatever this urban development looks like.
Yes, the urban development where there is high density, the density is high, is when you find that we need the government, for example, to come in and, number one, provide what we are talking about as the Ministry of Health. Water needs always to be there. Whether it's going to be provided for free, but it needs always to be there to ensure that people can wash their hands. Then the roads needs to be improved. Accessibility of where these people are living needs to be improved, so that then they are able to access, when we need them to go there as health workers, we are able to access. Then the healthcare facilities, you might find that they are few compared to the population. So other private players like PENDA and even the government, we need now to come into the population, and we teach the population and also provide more personnel and more healthcare facilities to ensure that these people have access to care as and when it's required.
How Kenya is supposed to perform home care in slums? How do we go about that? How do you provide home care in slums, whether it is an individual who is showing asymptomatic symptoms or an individual who is recovering from it? How do you provide home care in slums?
Home care is likely, as the government has said, to be the next thing because of the overwhelmed healthcare system. But people, one of the things which has been taken very well by the population, even in the densely populated, is use of mask. People have accepted, and it needs to continue, even when you are in your house, especially when you have the symptoms. Then also hand washing with water and soap. What may be a challenge, and has been a challenge here, is the aspect of social distancing, even in the house, when you have a small household with many people, or even the social amenities out there, the market which is just next, or the water point which is not just next. But this then needs to be mitigated by the personal hygiene, and also taking care of your neighbor, where if they have a cough or they have these symptoms, you be there to advise them, hey, you need to go for this. Or then you also need to have the contact numbers of healthcare, like PENDA have given all our people 0207909045, where they can call our call center, and then we talk to them, we advise them, and we can deliver the drugs to them. So telemedicine is going to be the next thing. And in March, in April, PENDA started telemedicine.
Got it. Thank you so much, Dr. That's Dr. Gabriel Njue. He's the head of clinical service, just helping us make heads and tails of COVID-19 in our slum areas. Indeed, the best way to sort of solve this.